Hello, I'm Dr. Nina Wilson, a GP and menopause specialist based in Sussex, and I run the clinic One Woman Health, which is dedicated to meeting the health needs of women in midlife and beyond. Today we're talking about the product Evorel Sequi. This is a type of hormone replacement therapy that tends to be prescribed for women in perimenopause before their periods have stopped. We're going to have a look inside the packet to see what you'll find if it's prescribed for you and how to use it properly. It's called Sequi because it's a type of HRT known as sequential therapy, and that means that you get estrogen throughout the month but a progestogen for only the second half of the month, weeks 3 and 4. And if you remember, in a normal menstrual cycle, that's what happens too. You have estrogen throughout the month in varying levels, and the progesterone kicks in weeks 3 and 4. This type of product, a sequential product, fits in with the background hormonal activity that's happening in perimenopausal women and aims to support that. So let's take a look inside the box. When you open it up, you'll find that 8 patches is 1 month's supply. And if you look closely, that there are 2 different types of patch in the box. You have these labelled Evorel 50 and these labelled Evorel Conti. The Evorel 50s are the one that contain estrogen on its own. The Evorel Contis contain estrogen and a progestogen. And you'll remember that the progestogen is an important part of HRT because it stops the lining of the womb building up too much, which can cause problems with bleeding and other associated issues. So you use Evorel 50 for the first 2 weeks of your cycle and Evorel Conti for the weeks 3 and 4. That's the second 2 weeks of your cycle, and you alternate between the 2. Apply 1 patch to the buttocks or thighs and change it every 3 to 4 days. You'll need 4 patches to see you through each 2-week block. Don't apply any moisturiser before you stick the patch on to make sure it adheres properly to the skin, and once it's there you can shower or swim with it and it won't affect the delivery of the product. However, if you find it isn't sticking very well, you should speak to your doctor because it can affect how much will be getting into your body and therefore may affect how well it works for you. I hope you found that helpful. If so, please subscribe and I'll be making more videos taking you through the ins and outs of HRT and health at midlife. And you can also check out my website, www.onewomanhealth.com.